Hi everyone, I'm Dr. Benji and I'm here with Garden OBGYN's own Miss Casey Collins. How you doing?
Hi everyone. I'm good. So nice to be here.
Yeah, I'm so glad we're able to collaborate. I'm here to have a brief convo with Casey about pregnancy and foot and really lower extremity issues. And since you see a lot more than I do, I figured we could kind of, blend our specialties together to give some of our patients some help.
Absolutely.
Yeah.
So
I
yes,
Can you tell me what are some simple tips that your patients? So let me back up. A lot of my patients who are pregnant, they get what's called ligamentous laxity. So like their ligaments relax, and they develop everything from heel pain to just standard foot and leg swelling. So like in your practice, what are some of the nice, holistic tips that you give them to give them, relief?
yeah. So usually when it comes to swelling, I usually advise my patients to reduce any sodium intake because where sodium goes,
Mhm.
water goes. So we first start with any dietary restrictions. The
Yeah,
second would be to increase hydration. That helps a lot to kind of combat any fluid volume. I also
really.
recommend that,
Okay.
yeah, I usually recommend that they try to avoid standing for long periods of time by resting and elevating their legs. That's
Yeah.
always
How
beneficial.
much? I like to think of you said about water. How much do you recommend that they drink per day?
Definitely more than 6 to 8 glasses of water. I
Okay.
tell my patients to stay super hydrated just
Uh,
in general to
uh-huh.
combat other issues due to the
Yeah.
hormonal changes from pregnancy, but definitely increased hydration is important.
Uh-huh. Yeah. And then you said elevated their legs.
Yep.
Yeah. That's
Resting, not being on the feet for too long.
yeah, standing. I also recommend patients to soak their feet with Epsom salt and lavender oil. You ever tried that?
Absolutely.
Yeah,
Yeah,
I actually do it
absolutely.
like every other Sunday. I have a daughter and she'll get in. I'm like, let me just pour some Epsom salt in here, see what happens. It really does
I
work.
do the same thing. It does
Yeah.
after a long day of work. I usually
Yeah.
do an Epsom salt
Yeah.
bath. So it makes a big difference,
Yeah.
especially for soreness as well. Absolutely.
What about what are your thoughts about so like I make custom inserts for patients. What about like shoes? Like you tell them like maybe not walk barefooted very long, or is it certain shoes that you like that you recommend, or is it more just, stay off your feet and don't stay in for too long?
Usually, when it comes to footwear, I usually tell them to wear shoes that can accommodate any expansion or swelling of the feet, something
Yeah.
that actually has some room, the
Yeah.
wiggle room.
Yeah.
I don't have a particular brand that I recommend per se. I guess that would be more of your area, but absolutely. Yeah,
Yeah, I love, oh my God, you have to write this down. It's called Vionic. It's like Bionic with a V. They make, so
bionic.
it's, yeah, they're like a sandal company and they make,
Uh huh.
I own a couple pair, so I guess
That's
I really
awesome.
like them. They have inserts created inside the sandals, so like you can wear them to the beach, you can wear them to a friend's house. I wear their slippers as well. And so for pregnant patients, I'm like, listen, you're gonna buy them for your pregnancy, and you're gonna wear them after your pregnancy. And they're like, okay, I'm sold.
Right. Yeah.
So I think that's clutch. And then so one last thing, I find it really helpful. So those foot massagers on Amazon, they're like 120 bucks. They make them to where it's your foot and it goes all the way up to your leg. I tell you, it is
Wow.
so, so good. And it's well worth it. Like even, we still
Absolutely.
have it in our house. We still use it. My wife's pregnant right now, so she's using it
Oh,
periodically. But
congrats. Yes.
thank you. But it works. It really works.
Yeah. Pregnancy massages are also great.
Ah,
In addition, swimming is really good just because of the beneficial effects on the water pressure. They kind of
yeah,
help to increase
circulation.
circulation and reduce the swelling. Yeah.
Ah, so that's good. So
Yeah.
tell me about um, sciatica. So in pregnancy, I read that sciatica or nerve pain in the back and the hips is not fairly common, but it does occur. What are some tips that you can give patients to help get relief? Because I'll have you answer that, and I also have an answer for you as well. So,
Right. So sciatica usually occurs in pregnancy because of the expansion of the uterus that can compress,
oh,
inflame, and pinch the sciatic nerve, which is the
uh-huh,
nerve that runs from the lower back, buttocks to the lower limbs.
uh-huh,
So with that compression, people usually report having that numbness, that one-sided pain.
yeah,
That's just really, really annoying.
Yeah.
Usually I recommend Tylenol, which is recommended for pain relief in pregnancy. Heating pads, warm showers are really good. Yoga, the massages you mentioned, physical therapy. But honestly, I actually recommend my patients to podiatrists like yourself.
Oh,
Like
get out of here.
podiatry is
Okay.
super, super important.
Yeah,
Absolutely.
I founded a company called Nerve Assist, and it's basically antioxidants that help with nerve pain. So,
Wow.
full disclosure, like I'll tell a few of my patients, if it's sciatic nerve pain or it's low back pain from pregnancy, just try it. It's a vitamin, it's not a medication. And then I also founded a freeze gel. So it's get this, I love this. I locally source everything. I went to the manufacturer myself. It's arnica flour, it's a fresh peppermint extract, rosemary oil, a tea tree oil, turmeric extracts, and menthol. And we all
Oh,
mix
wow.
it together and we store it in the fridge, and it helps reinvigorate and activate the menthol. So when you put it on, I even put it on my father-in-law a few weeks ago, and it's like, oh my god, this is super cold, and it
Yeah.
and it works. And the whole idea is that if you're able, not only with the supplements, with the freeze gel, to decrease the inflammation and help regenerate or repair nerve cells, naturally the sciatic nerve will begin to calm down, and only like as well as applying the topical medication on top of it, it'll help calm it down. And so I think that's super important. I like what you said about yoga too. I think yoga is
Big.
clutch. Yeah.
Yes, I think it's so underestimated. Really good. The stretching definitely plays a role.
I
Yeah.
will say, so we have a Peloton, and Peloton, for those of you watching, they have a yoga class, and they have a yoga class prenatal and postnatal class. And
Oh, that's
it's no
amazing.
lie, I was like, let me just see what this is about. It is super no, super awesome. I was like, I think I could do this class.
Really?
Yeah, it's
Wow.
really, really helpful. I'm sure, and I'm sure you could attest to this. YouTube has like thousands of videos for that as
Yes,
well.
they
No?
do. Yes, they do. YouTube is amazing. I love YouTube.
Okay, well, I think that's more than enough. I think we gave them 10 different things to try. For those of you watching, stay tuned. We're going to be doing this every other week, and give you guys constant tips. And if there's anything else you'd like to add, the floor is yours.
Yeah, like I said, the body goes through several changes during pregnancy, but you don't have to suffer. Please see a specialist. If you're having any issues, see Dr. Benji. You can come and see me
Go
at
see
Garden of
Casey.
Ryan.
There we
That's
go.
right. I will take care of you because pregnancy
Which
can be a
location
beautiful
are you at?
experience.
Which location are you at?
So there's so many locations, but as of right now, I am in Garden City, so you can
Garden
always
City.
come and check me out.
Okay, I love it. Everyone go see her in Garden City. Yeah.
Yay!
All right. So good to see you. Thank you so much for your time.
Yes, thank you so much, Dr. Benji. Have a
Okay.
great one.
Thank you. Bye.
Bye.